Disclaimer: this podcast is only for informational purposes and not intended to be substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions that you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it. Hello everyone, welcome to my podcast, Dr. Lavi's Cup of Coffee. I am Lavi, a fourth year medical student and your host for this podcast. First of all, I would like to thank all of you for the wonderful response I got on my first video, Baby on Board. And I really didn't expected this much views, and I think Baby really hit very hard. Anyways, I would continue to give these type of episodes in future as well. I want to apologize also because I'm a final year medical student. I won't be able to give episodes very frequently. Maybe in the future I would increase my consistency and give you much better quality episodes. So please bear up with me for the timing, and let's get started with our today's episode, Falling for You. A 36-year-old chemist with a 15-year history of bipolar disorder is rushed to the emergency department by his wife, who saw him fell down and was lying unconscious in the living room of their house. The patient's wife reports that he is prescribed lithium but does not take it regularly. The man's skin is bright red like a cherry, and he is breathing very rapidly, and his breath smells like bitter almonds. Based on above history, can you guess what could be the diagnosis? Diagnosis for this case is cyanide poisoning, as bitter almond breath in history is pathognomic for this type of poisoning. Which enzyme does the cyanide inhibits in electron transport chain? It's the cytochrome oxidase, which helps in the formation of ATP. What other substances inhibit electron transport chain? It's the amytal, rotenone, antimycin A, azides, carbon monoxide, and etc. So what cyanide is doing? It's combining with hemoglobin, or it is acting on tissue to prevent oxygen to reach the tissues, and it's also acting on the electron transport chain. So it is inhibiting the formation of ATP. So my next loaded question to you guys is, for collecting the samples in case of cyanide poisoning, blood is withdrawn and preserved in which chemical? It's the fluoride, same as we do for glucose estimation. The person in cyanide poisoning looks bright red like a cherry. Can you recall which other poisoning looks like the similar? It's the carbon monoxide poisoning, or the exposure of dead body to the cold. Normally, cyanide do exist in nature in the form of hydrocyanic acid or the prussic acid in many of the fruits and leaves such as almonds, apricots, apple, cherry, peaches, plums, where it exists in the form of glucoside amygdalin, which is harmless initially. But it can coexist with the enzyme emulsin, which hydrolyzes it to form hydrocyanic acid, which also occurs in small intestine with the help of a bacteria. Interestingly, the ability to detect the smell of hydrocyanic acid gas is found only in 20 to 40% of general population, which is a sex-linked recessive trait. And cyanides are very commonly used in metallurgy, photography, electroplating, spraying in agriculture. So people related to these professions are at a very higher risk for the poisoning. On the other hand, cyanide is like a double-edged sword, because potassium ferrocyanide and potassium ferricyanide is not at all poisoning, and they are used as an antidote. Can you guys tell me that these are used as antidote in which of the poisoning? Yes, surprisingly, it's the copper poisoning. Cyanide is a very potent poison, and it's absorbed rapidly from skin and in the gaseous form from the respiratory system, salts from the stomach, and moreover, absorption can reduce when it's taken on full stomach or with the wine. It's excreted out unchanged in the breath and also in urine. Its fatal dose is 50 to 60 milligram, and its fatal period is 2 to 10 minutes. Moreover, it can kill you immediately also. And let's move on to the clinical features which are shown by the person of cyanide poisoning. Moving from head to toe findings, in CNS we encounter headache, vertigo, faintness, excitement, confusion. And in eyes we see pupil dilated or even unreactive, glassy and very prominent. In skin we see perspiration, which is heavy sweating. And in CVS, Initially hypertension with reflex bradycardia, but later on tachycardia with hypotension and circulatory collapse. And moving on further, in respiratory system, bitter almond breath, tachypnea, dyspnea due to stimulation of chemoreceptors and respiratory center in the brain. And moving further down in GIT, bitter taste, burning or numbness of the throat, salivation, nausea and vomiting. And in renal system, acidosis. Let's move further. How will you treat the patient? Treatment should be started as immediate as possible. Principle of the treatment is to reverse the cyanide cytochrome oxidase complex which was formed initially by giving nitrites with sodium thiosulfate, which converts hemoglobin to methemoglobin. Methemoglobin has a higher affinity for cyanide than the cytochrome oxidase, so it will help in removal of cyanide from the body in the form of thiocyanides, which gets excreted out easily in urine. And for cyanide poisoning, hydroxycobalamin or the vitamin B12 is also given, which gets converted into cyanocobalamin and excreted out of the body. Other treatment options include dicobalt EDTA and 4-dimethyl aminophenol, which can also be used and they are less toxic than the nitrites. As well as the gastric lavage, stomach wash can also be done, ventilating the patient with 100% oxygen, keeping the airway clean, and moving on to the fresh air and resuscitate if needed. And if the methemoglobin level is more than 50%, it is an indication for the exchange transfusion or the blood administration, and keep the patient under observation for 24 to 48 hours as symptoms can reoccur again. Based on the given history and keeping the clinical features on one side, how can you guys 100%ly say that it's a case of cyanide poisoning? The patient is having bipolar disorder, right? So he might be doing some illegal drugs and involved in self injurious behavior to kill himself. So it is very likely to be cyanide poisoning only. As I'm very keen on integrating subjects, so I also want to discuss on the forensic medicine aspect related to cyanide poisoning too. So what all post-mortem findings can you see in the case of cyanide poisoning? Eyes look bright, glistening with the dilated pupils. Jaws firmly closed and frothing is present at mouth. Cherry red postmortem staining can be seen due to formation of cyan with hemoglobin. Cranial cavity should be opened first and the smell of hydrocyanic acid is present. Blood-stained frothy secretions are present in trachea and bronchi as well, edema of lungs and congestion of viscera. Potassium or sodium cyanide produces mucosal erosions, which leads to blackening due to formation of alkaline hematin. Specimen of blood is preserved in fluoride and it should be covered with the layer of liquid paraffin to avoid the evaporation. Pack the lungs intact in nylon bag and remember no embalming or formaldehyde because it rapidly destroys cyanide. Cyanide can be used for homicide and cattle poison in the form of suicidal pills and accidental fumes, and even as judicial execution in some of the countries. And it was also used for killing the Jews in gas chambers by the Nazis at the time of Second World War. Guys, do you know about the Lees-Jones test? In this test, we take 5 ml of the stomach contents, few crystals of iron sulfate, 5 drops of 2% sodium hydroxide. We cool it, 10 drops of 10% HCl. And if the solution turns out greenish blue in color, then the cyanide poisoning is confirmed. Okay guys, that's the end for cyanide poisoning. Hope all this made some sense and you got some insight about the various things in this topic, as I too got to know many new things regarding this topic when I was preparing for this episode. And if you have any query, you can comment down in YouTube or even the question answer section in Spotify, and follow the Instagram page and Facebook page of Dr. Lavi's Cup of Coffee. Goodbye and happy learning.